All right. Well, welcome everybody to Breaching the Boardroom podcast. I am your host, David Morrow. In the studio today is a seasoned leader, very experienced. We're excited about the opportunity to sit down with her. It's Etene Terrell-Fakorede, in leadership and head of Encompass Health. Etene, welcome to the studio.
Hi, thanks for having me, David. I am the Chief Executive Officer for the Rehabilitation Institute of Ohio of Encompass Health here in Dayton, Ohio. We are one of about 160 or so inpatient rehabilitation hospitals all over the United States and in Puerto Rico.
That's phenomenal. And for those that don't know, I've worked in and out of healthcare my whole career, and the rehabilitation hospitals are really significant in terms of critical infrastructure. You all handle some of the longer term rehab for like very serious accidents, don't you? And very serious events and conditions. Like when you hear of, massive gunshot wounds and people that have lost limbs and all of that, like the rehab clinics are the rehabilitation centers really do a remarkable job with that intense therapy and getting people assimilated again.
Yeah, correct. When you think about anytime that you hear the helicopters going over
The
to
flight for
a
life.
trauma, yeah, the
Yeah.
life flights. Anytime that you hear about a family member, friend who may have had a stroke, who may have had some debilitating accident of some sort, or even someone with my own experience. I just recently had a knee replacement. If I had was a certain age and maybe had two knees done, then a rehab hospital like my own might be someplace where I might go to get back to my health.
Yeah.
In some cases, it's about getting back to normal, but then sometimes it's about adjusting to a new normal, depending on the severity of the accident. Um, as mentioned, accidents and also traumatic brain injury, strokes. And when you
Yep.
think about the type of patient that comes through our door, it's the treatment of the patient, not just the patient, but also their families and their friends and the people who will support them once they leave us. It's a really holistic approach to healing the patient.
Well, and I want to get into like your background because you didn't
Sure.
start in medicine. Um,
No, I didn't.
yeah, but before we get there, in your role, patient outcomes and
Yeah.
patient care
Mhm.
and the people that work in that field, we do a lot with rural healthcare that
Mhm.
struggles and helping them out any way we can.
Yeah.
Um, but oftentimes the goal for top patient care and patient outcomes can conflict with or at least intertwine with the business reality, right? And
Right.
so in your role you have to navigate both. And
Every
so
day,
yeah,
every single
can
day.
you walk us through and I know there's a lot of changes in healthcare. There's some changes with HIPAA coming, and there's recent there's a shift from fee for service to value add care that I always
Mhm.
like to ask about, and because I'm an idiot and I still don't understand it all, so I always want to know from people that live it every day so that I can speak correctly and understand it. But
Yeah.
walk us through when those two conflict or they intertwine, like how do
Yeah.
you bridge that gap? Like
Well,
that is a significant leadership challenge. So
well,
how are you
it
addressing?
is. It comes from understanding where you are in as far as zip code, county, state. It is about knowing the demographics and even the medical makeup of where you are. In the state of Ohio, in particular, we have a very high population of high blood pressure, diabetes, and therefore we have a lot of strokes here. And with that comes various types of payer sources, and it's understanding what that looks like as far as getting patients not only in the door, but how can we get them out safely, create a safe discharge plan. And where that comes in conflict might not necessarily be where you would think. Sometimes it's with the expectations of family versus what family and the patient versus what the body can do. So there are some times when patients will come in our door to receive care and they would love to be able to go home. However, there are times when that is just not the safest option for them, and they might need to go, unfortunately, to a lower level of care, like a skilled care facility, similarly called a nursing home. And that might end up being what's best. And when you navigate those waters, there is a fine line between knowing and understanding what that reality might be for that patient and family versus what they want it to be. But there is definitely something to be said for heart and passion and the way that a person's mind can really take hold and determine what that outcome looks like. We have seen people come in our door who can barely move a finger, but then they walk out with a walker or even roll out in a wheelchair using their own power. So there's definitely something to be said for the will of the human spirit, and it's just about how we do deal with that. You mentioned there's so many different changes with Medicare, Medicaid, all those types of things, and we really don't exactly know how that will all shake out. We probably won't know truly for a few years, but in the now, our goal is to make sure that people know and understand what we do, how we do it, and how we can best serve.
That's excellent. So you brought up a lot of good subjects, and I want to be, each one of them could be a podcast episode because you just mentioned a whole bunch of things. But the heart and the human spirit, how do you? And I guess maybe it's, walk me through this. I mean, maybe it's different in healthcare. I think it is. I know in just regular businesses,
Mm-hmm.
right? Leaders have to get things done. Their teams need to execute in timelines and get things done.
Yeah.
And yet to keep talent, we have to have a positive culture and things. And you can't just be everybody's friend because then nothing gets done because no one's going to go above and beyond for their buddy, but they will for a bigger cause or for a leadership vision or for an inspiring platform or leader. How do you balance that? And the reason I said maybe healthcare is different is I think people that go into healthcare, sweeping generalization, right? But I would think there's a higher calling. I see it in cybersecurity. I see people that are like, yeah, I get the technology piece. That's cool and all, but I'm doing this for national security. I'm doing this because I believe in our country or whatever. Like it's a higher calling, a bigger than any company, any person. Right.
Right.
And I think the same would apply in healthcare.
Yeah. And you're exactly right. You mentioned maybe not necessarily in business, but definitely called healthcare. So you referenced earlier about I didn't arrive in healthcare. That was not my first journey.
You were in retail management, weren't you?
Yeah, I was.
That's
I
a shift.
lines. Yeah, well, it was. And the shift came after we had our second child. And just, I really, you hear more about it today about work-life balance. Wasn't so much a thing that we talked about then. That child now is 26. And that's
I was going to say back in the 90s, back in the 80s and 90s, like work-life balance was just like get back to work.
Who cared?
Like,
you just needed to work.
Yeah. There wasn't really thought to that.
No. And you really didn't even want to talk about it.
No.
At all. And so after, several years in the retail space and, leading wonderful teams there, after we had Shayna, she's going to be embarrassed that I mentioned her name, but after we had her, it was one of those things where, okay, the cost of childcare versus both of us working. And I said, well, you know what? I'll be a stay-at-home mom. And I tell this story so much that lasted 30 days. And
Really?
yeah,
Now,
no, I couldn't. Yeah, I said I gotta do
yeah,
something else. I told my lady, I was like, yeah, y'all want a whole lot. I need to go to work. But what I did do is because I did want to make sure that I was able to be present at home
right.
more than I had been. You know, holidays with kids is really a special time. I definitely didn't want to miss that anymore.
Well, and
And
retail will take that away.
that it will steal it
Yeah,
if you let it.
right.
Um,
Yep.
and so I wanted to shift gears into human resources and actually applied for to be a placement recruiter for a temporary agency. And when I showed up for the interview, they had already filled it internally, but they asked me if I would want to be, you know, one of the people that they would place in different temporary roles. And I said, not for me. I appreciate what you guys do. This is just not what I'm looking for, but thank you.
And
But
so many people can picture themselves right where you
yeah,
were at. Like that
yeah.
has happened to so like everybody's almost been there,
Mhm,
especially
mhm.
earlier in life when you're figuring
Well,
out career moves and you
right,
got some degree that isn't really in a field that you want to go
and
into. It's like so
reevaluating your
many people are
priorities.
there.
Yeah,
Yeah.
yeah, and that's what happens, you know, when life happens, no matter what that life-changing event is, you do start to reevaluate your priorities, and
Mhm.
that's pretty much what happened there, but, when they called me 2 weeks later, they asked me if I would go and work for 1 day at a wound care center. And I did not have any idea what that was. I thought that they said womb.
So you thought it was a
Y
woman's center.
Yes, I thought it was something like that, but
That's
they said
great.
wound, and I said, "Well, what do they need?" And they said, "Could you just, answer the phone for them?" I said, "Okay, fine, whatever." And they didn't offer it to their regular temporary people because those people were looking for, long-term assignments,
Right.
and they just really asked if I could do them that favor because they knew that really wasn't what I was looking for, but just they maybe I wouldn't mind to do one assignment. And so I walked in to a wound care center at OSU, and that was the day that my career, my passion began in healthcare. And you're right, people are called to serve. Sometimes when you're born, sometimes you start in your career path, you don't know where you're going to go. I started off pursuing my degree in political science at Kentucky State University. And, life happened. I got into retail. And then when I went in that one day, I'm going to mention another name, Lynn Lambert. She hired me at that time with the wound care center. I was answering the phone for that one day, and I'll never forget it. It was the Friday before Memorial Day. I was just supposed to work that day. Something happened. I do believe in divine intervention. And so I was asked to come back on that following Tuesday because the person who was supposed to be there was not coming back. And from that point
Interesting.
forward, I've always been a person who wants to learn and do. And I was sitting there and I don't like to be bored. And just there were all these things happening around me. And I said, well, I can help with that. I can help with this. Whatever it is, that is what I will do. And I've carried that with me throughout my entire career. When you talk about leading people and getting them on mission and staying on mission and understanding what the vision is that we have for our patients and how we move forward to succeed, it's that for me is what that looks like. It looks like the leader being willing to do whatever it is is necessary to take care of the patient, not tied to a job title, not tied to a job description, but doing whatever it is to take and get the job done. I will give you an example. Today is free lunch Thursday here at our hospital. And so today it was my turn to go and serve. I was in a meeting that was wrapping up and I said, you know what? I got to go. I'm sorry. I got to go serve lunch. But that's just something that we do.
As the CEO, as the CEO.
Yeah, as a
Yeah.
CEO. And
Which is wonderful.
because that's just what you do. You make yourself available. The the people that you are responsible for, they have to know that you are willing to not just sit high and look down low, but you're willing to get up and help them with whatever that looks like. I have served in the kitchen. I've mopped floors. I've taken out trash. I've done all these different things. We before we got on air, we talked about my knee had been out, and so we had hired some new people while I was away, and so free lunch Thursday had popped up, and there were some wonderful folks. We got a great team of people here, and I go and I'm washing my hands. I put on my hair net and I go around to go ahead and start serving. And one of the folks who had been hired since I had been out on leave, they said, "What are you doing?" I said, I'm about to go and serve lunch. It's my turn. They're like, "You don't do that. We do that for you." I said, "No, no, no, no." And the
That's
other
great.
people who had been here for a while, they all kind of chuckled. I said, "Don't worry about it. You'll get used to it. This is just what I do." Because that's what brings me joy. And I think that when people can see you move like that, just jump in like that, they're very much willing to do the same. And what's great about it is you don't even have to ask. You don't even have to ask people to do these things. They see that it needs done, they do it. I always enjoy giving the conversation to our new hires because that's when I share my own journey about how I even landed in inpatient rehab. And that's through my late husband, who had a major multiple trauma, then had a stroke, and then needed the services of an inpatient rehabilitation hospital. So there was a great appreciation of what people do in this setting. And also, too, the support that comes not just for the patient, but for the families, too. And we go around as a leadership team. We meet with families and patients. We greet them when they come in. We talk to them throughout the stay. We talk to them before they go home. We want to make sure that they're understanding everything. You're talking about people who've gone through a life event that we don't get there's no instruction manual for that.
Right.
Um, you,
Nobody prepares you for
nobody,
trauma
nobody
like
could.
that.
Nobody could ever prepare you for that. And the biggest part of that is understanding that with every single one of these patients, every single one of these families, I don't care if there were 15 strokes all at the same time. Each of those families and each of those patients are dealing with that very differently. And it's our responsibility to meet them where they are and help them get through. And
That's phenomenal. Um, how do you instill your vision for your organization? Meaning, there is a higher calling there in healthcare, and especially in the type of healthcare that you're in, right? As opposed to, more technical healthcare or something that's
mhm,
separated from the patient. You guys are
mhm,
right there at a time of
yeah,
crisis and trauma.
crisis.
And
Yeah,
so there's a lot of psychology involved. There's a lot of emotional
it is.
support involved. People are going through some of the most horrible times that they never planned on.
No.
Um, how did you like? How do you get initiatives driven down, balancing both the emotional aspect and the patient care and the business aspect? Do you
Well,
just kind of explain to the team, we know we need X, Y, and Z. It's just not in budget right now, but I'm working on it. Like, how do you relay that communication so that they know you still have their back?
well, and so that's the thing. So that part changes all the time
Mm,
because the type of communication that each staff member needs to be able to understand where you're going, what you're doing looks different, right? Um, the biggest thing that we do, part of our core values, is leading with empathy. And that goes for our patients, families, and also the people who serve our patients and families. And those are the people who I serve. I serve these families. I serve the staff. And we have focus groups and town hall meetings every quarter, every single quarter. And we do that because with a staff this large, I might have a conversation with you today or with your team today, right? But I didn't talk with another team yet. So it's vital to be able to have communication boards in the hospital that are visible for everyone. And that's one of the things that we do. And we started that because there are so many things, so many good things that are going on in our hospital all the time, but maybe it didn't happen on the day that you worked.
right.
And maybe you are one of the staff who don't have access to email like so many other ones do. So we have a board in the cafeteria that has on there, if you have an idea of a way to make it better for patients, staff, or families, then you can put that on the board. You can put your name on it if you want to, but it can also be anonymous. But we, as a leadership team, we take those down, we review them every week, and we review them. And just to your
And
point,
they know that you review them. So I think it's
yeah, the
important
leadership
that
team
they know
reviews
that
them.
they're heard,
Yeah,
right?
exactly. And there's a column on our board that says in progress.
Oh, great.
Yeah, yeah, because sometimes, to your point, it might take a while for some things to happen. Right now, as people are more conscious about their health and things like that, and even hydrating, for example, during COVID, the water fountains were all shut down.
Right.
Well, now everybody is carrying around their water bottles. I've got one, it's like 64 ounces right to my side over here. But we hadn't turned the water fountains back on. And so a staff member put up on the board, can we get a hydration station? Can we convert the water fountains to hydration stations? So I asked my plant operations director, I said, well, what would it take for us to do that? And so we found out. Now we couldn't do it this year due to capital, to your point, but we did put it up on the in progress piece with an explanation as to what was going on with it and that they could look for that
That's
in
wonderful.
2026. And
That's
but there,
great.
yeah, yeah. Well, and then there's some other things you can just put an immediate W in the
And,
win column,
and you
but
didn't need AI or any tech platform to get that process
no,
done, did you?
no,
You
no,
just needed
no.
a friggin' whiteboard
Yeah,
and a dry erase marker, right? I love it.
these little blue cards.
Yes. That's
These
great.
little blue cards that go up on a board, they are able to write whatever they want on them, and we make a point to discuss them every week. But it's all about trust. How do you build trust among those people? And you build trust by open and honest communication, because sometimes the answer might be no, but give that no with an explanation. Sometimes it might be not right now.
Right.
Provide an explanation, but be transparent with the communication, because as we all know, if we're very imaginative people, we're human beings, our brains are always thinking of different things. If we allow our imagination to fill in the gaps, then unfortunately it doesn't fill in the gap in a positive way that we would like it to. So
Oh,
we need to make a point to just be very open and honest with that communication, and also have an open door policy, but also understand that just because you have an open door policy, please don't stay in your office. Please be out there with staff. I believe in servant leadership. I believe that while I'm here in this hospital, I am in service too. And the things that are my sole responsibility, I can take care of. But when I am here, I am in service too. I provide my contact information. It's everywhere in this hospital. I always say, this is my work phone. I've got two phones, this one and my pink one. And the black phone that stays with me, when it rings, I will always answer it. And that's what I tell patients, their families, and also staff, because I know when that phone rings that someone needs something.
right.
And usually they've tried everybody else and tried everything else. And so I'm it. And so I will answer that phone. It's just about building the trust and delivering on the promise.
That's fantastic. And you mentioned the open door policy. A lot of organizations always say that, but that assumes a lot of things, right?
Yeah.
It assumes that there still is other accessibility. It
Hmm.
assumes that people are brave enough to walk in the door and ask for help, that you've created a culture that it's okay to fail, right? Because
Yes.
isn't that important? Like, isn't it important that people need to be trying things, try things
Yes.
out,
You have
throw it up
to.
against the wall. If
You
it
have to.
fails, we
You have
learn.
to.
Let's dissect it. Let's
Yes.
debrief on it and figure
Yes.
out maybe we can still get it to stick,
Yes.
or maybe we
Yes.
just pivot and go a different direction.
Well,
But
and that's the point. I think that's the point of growth. When I started my leadership journey, you know how it is. We all do it. We talk about, what we want to be, who we want to be, and how we want to behave. And one of the things that you also take away is like what you don't want to do. And when I have been meeting new people with every organization that I've been a part of, as I'm hiring on people, as I'm interviewing people, I let them know, say, I do have an open door policy, but I will let you know it's rarely that you'll find me in the office because I'm out of the office. I am also going to let you know that when you have a conversation with me, it's confidential. There is no fear of retaliation. There's not going to be any blowback on it. And especially with leadership position, especially new leaders, I very, very vocally say you have permission to fail. And
That's
I'm
really
telling you right
important.
now, you're going to fail. And it's
Right.
going to be okay. We're going to dust you off. We're going to help you get back up and we're going to learn from it. And when it comes to process changes and things like that, we are in an environment that requires ongoing process change. It
Yeah.
requires that we do, try to build a better mousetrap every single day,
Yep.
because on some days it might work for some patients, but on other days it might not. And the same goes for how you engage staff. Something might work for most, but it might not work for all. So you continue to try various things. We had the way that the board came to be is that I send out a Friday email every Friday. There are a whole lot of things that I put in there about what's going on in the hospital, upcoming events, and things like that. As I mentioned before, everybody doesn't have access to that. So I
Right.
said to every leader, print that off, have it be a part of your daily huddles, things like that. But the part that was missing was that piece with updates about all the projects that people had requested, suggested, things like that. And that's where the board came in, was so that we could continue to provide that feedback to them about the ideas that they have. But we have to always remember that when we first started, we fell down, we bumped our head, we may have bumped somebody else's head. We have our war wounds that made us who we are as leaders, and we're all the better for it. You do not come through this life and through any profession without having some bumps and bruises. We do make mistakes, we do make errors. The idea is the one, whoever wrote that book, failing up, because that's what we do, we strive to do. Whenever you get a new position, we've got a couple of new leaders now, and I have those one-on-ones with them. I'm like, and like, oh, I'm so sorry. I said, it's all right. It's okay.
Yeah.
You're learning. This is what this time is for. It's okay. And once you can build that trust, then when people do make an error that maybe it's not a small one, they trust that they can come to you and get your help to resolution, because that's what you want. It's just like with kids. You always want to, be there. You always want them to be able to confide in you. I remember as the kids were growing up, like they might say something. I'm trying to keep a straight face. Like, oh, not go, oh my God, did they
Right.
you know, because you want to keep the door open. You want to keep the lines of communication open with them. And it's the same thing when you're leading teams. You want to have a safe space for people to share their thoughts and ideas without fear.
Yeah.
And
Simon Sinek talks about it. He talks about psychological safety and
mhm,
how it helps people achieve more and organizations achieve
mhm,
more, and that the data supports it.
yeah,
I would agree with that. I mean, I don't see how, because I grew up at a time when the opposite was kind of popular, right? Where like they led by fear and everything else, and people just kind of put their heads down. They were afraid to make a move. They would, basically work for the paycheck and then bolt
yeah,
and take the
yeah,
next better job that's out there.
mhm,
And
yeah,
that's not, first of all, attrition is a
mm-mm,
huge loss
no,
leader from an employer's
mhm,
perspective. And the the ability to coach somebody up, right? I mean,
yeah,
you give them the opportunity to fail, and then you teach them the right way, and then they move
yeah,
on, and
yeah,
then you've got a successful team member. Now, if
yeah.
they don't ever learn, then there's a different issue. Like
It's a different
that's a
issue.
different issue, but that's more of the exception than the rule.
It is, but you know what? It also means accountability. And
Yeah,
what
exactly.
sometimes people don't understand too is accountability also breeds trust.
Hmm.
When you have those instances where you do have someone who cannot be coached, unwilling to coach, the
Right.
hill or will factor, then if they're allowed to remain, and you've got all those people who are like really hungry and they're doing their best, giving you 150% every day without you even asking,
Yeah, that's bad for culture, isn't it?
it's very bad for culture.
Hmm.
So, yeah, and that's the part I think, especially in healthcare, we do have a habit. of, depending on what type of organization, it might be move, as you've heard, moving around the bad penny.
Right.
And, we take so long sometimes to go ahead and do the right thing as far as those types of accountability measures are concerned. But at the end of the day, it does so good for staff morale. And when you think about sustainable changes that have to be made within any organization, you have the best success with sustaining those changes when you have people who are stable and confident and secure in their positions.
Yeah, absolutely. I wanted to ask you, when you're, and I'm sorry about the loss of your husband,
Mhm.
did, were you involved in rehabilitation, in leadership, in that role before he had to be
No,
a
no, I
patient
wasn't.
of it? Or is that
No,
one of
so
the things that inspired you to do it? I was curious about the timeline.
my late husband Daryl, he passed away, and at the time, I was actually working with bariatric surgery and weight management. I was the director of
Ah,
that program at OSU.
yeah.
And at that point in time, he was going through his illness. He From the accident till the time he passed, it was about 9 years or so. And again, everything happens in your life for a reason, and timing truly is everything. When and I like I said, I believe in divine intervention. I believe that I've been placed in places and spaces at the right time for the right reasons. And I believe that where I was at the time was the right place for me, for him, and our family, because I needed to be rooted in a place where we had small kids at the time, and I worked with an organization and I had leaders above me that understood what we were going through as a family, and so that was very helpful. However, when he did pass, it was a few years later that I actually became aware of inpatient rehab. Now, Daryl had been in a rehab hospital. He had been in a skilled facility and all those types of things. And when this opportunity became available with Encompass, specifically in Dayton, Ohio, I heard and researched, and I even told the folks as I was interviewing for the position, I said, I wish I had known about Encompass when Daryl was going through his illness. Grant you the care that he did receive at those various places, he was provided a great, great care. But I will say Encompass is different. It's just
Right. And now you know the inner workings, and so you
Mhm.
wish you could have had an
Yeah,
experience that.
yeah. So that's not what brought me here necessarily, but it's why I love it. It's why I'm very passionate about it. It is also when patients and families come in for a tour, I believe that it's important to provide them some privacy, a safe space, and I want to hear about their loved one.
Yep.
They're coming here for a tour. There's something that happened in their life. And sometimes families just need a place where they can just cry, where they can just share. And they may not have been able to do that because their family member may have gone through a stroke or an accident. And, they have to keep up that brave face and be strong for their loved one. And for me and our leadership team, that's how we all do a tour here. We provide the patient's family privacy and space to just talk about what their needs are. And we want to make sure that they know that we're here to very much support their family member, but also to help them too. We want to make sure that they know that we're available. They can ask us questions, and this is not anything that they were prepared for. One of our therapists, Jason, he says, when we come in contact with these families and these patients, they have likely experienced the most traumatic event that they will ever experience in their entire lives.
So it's
And
a totally different approach than what most people experience. I mean,
mhm,
it is very leading with empathy is critical.
it is, it is,
It's a condition precedent to that for sure.
it is, it really truly is, and
I wanted to ask you about
good.
mentorship. as you
Yeah.
were transitioning and you worked at the temporary agency, which a lot of young people and even older people find themselves just seeking some work from, and then you found a place where you're like,
Hmm.
okay, I think I found my thing
Yeah.
now. Like
Yeah.
this is
Yeah.
pretty good. Like,
Yeah.
did you ever connect with a mentor? Did
Oh,
you
yeah.
like? Well,
Oh,
what
yeah.
type of things can you share about what that
Oh, heck yeah.
experience was like?
And they're all different for various reasons, and they gave me
Yeah.
different things. So Lynn Lambert, who I mentioned before,
Yep.
she was the one who gave me my first job in healthcare. And the thing that she taught me was, in order for you to leave where you are, you had better be training your replacement. And that let
Interesting.
well, and it's and sometimes people don't take it that way. But the thing is that when you are willing to share the knowledge that you have, that also instills trust. It means that I see something in you, but even if I don't necessarily see it, but you got a hunger in your belly for it, I'm going to be happy to show you and train you everything that I have, everything that I know. And she did that for me. She shared with me, she taught me all those things. Then came a wonderful mentor, Rhonda Crow. And Rhonda, she allowed me to be me. And she said, pretty much, there are things that you've got to be able to identify in people what their strengths are. And when you can allow them to be their authentic selves, tap into that part of who they are and allow that to just flourish and flow and nurture that, you get the best out of those people. And that's what she did for me. She said one time, she goes, you know what, if people just would just let you go, you'll do stuff. And so she did do that for me. Another one was Mary Angela Miller, one of the Miller sisters of Ohio, who was Mary Angela Miller not only taught me how to a lot of strength as a leader. She was one of my administrators at Ohio State, but Mary Angela Miller, she was an awesome teacher when it came to
Is that one of the Millers who created the like Miller's Manor and some of
no,
those?
no, no,
It's
no. So
different,
I
but they
make
were
that
in
joke about
healthcare
Mary
and
Angela, and I'm going to have to
rehabilitation.
tell her. No, I'm going
Yeah,
to tell her about this podcast that I mentioned her and her sisters. Uh,
that's great.
she's got a lot of sisters. No, but Mary Angela, when you are a leader and you have a lot of different communications and you're leading up, right? She taught me very well how to do that. Many times you have to know and understand not just who reports to you, but who you report to, and what communication styles work best for them.
Hmm.
And then Kathy Thomas taught me, and all of these people I still remain in contact with today. She taught me even more about compassion, even though I
How
thought,
so?
because Kathy, I am a person in my written word, it might not come out as soft as what my heart is. And so Kathy was able to give me very frank and honest feedback, but in the most compassionate way ever,
Mm,
ever.
that's a good
And
lesson.
yeah, and when it also tells you, we always have to be open to receiving the feedback. And it was an email that I'd sent. Like I said, my written words not always as soft as my heart is. And she said, I just want to let you know that that might have come off a little harsh, and and just to let you know. But she was the sweetest, most wonderful person, and each one of those people just allowed me to grow more and more with every little piece and part. I did leave off Trish Neal Wilson. So Trish, when I was with bariatric and weight management, we did some things with training and education of the team there, and that's when I got exposed to Lean and Six Sigma, because I'm a lifelong learner, and anything that I learn, I always want to share it. And I brought in the folks from Fisher to teach my team, to do a workshop on Lean Six Sigma. And I'm a firm believer in, I'm not going to come in your house and redecorate your house for you, but I am going to give you the tools to do it yourself. Because when you build it, you're invested in it, there's buy-in, and we have much better outcomes with it. And so the team there, they revamped the getting to surgery process, and it was so successful. But you have to be in an environment where people will allow you to explore those pieces and parts of yourself that can also help your team grow. So
That's outstanding. That's and mentorship is so important. And
yeah.
one of the things that some guests have shared is sometimes people don't listen to the mentors. And
Hmm.
it's like for mentorship to work, like you bothered to ask for the advice, and
Yes.
they've hopefully you've asked advice
Hmm.
from somebody that literally has walked
Yeah.
down the path that
Right.
you're trying to go down.
Yes.
You may want to listen.
Yeah.
I mean,
Yeah.
you can still make it your own, but
Yes.
take the advice,
Take the advice. For instance, like when Kathy gave me that advice about my email communication, I could have just nodded my head and said, "Okay."
right? And then kept going the way you always were. It's so
Exactly.
funny that you said that because I've had the exact same thing told to me. Because the tone doesn't come out in email; it's like in text.
No, no,
You
no.
know?
Yeah. And I'm
Y-
just,
y-
it was just so concise, to the point where it was like, "Ooh, yeah,
Yeah, and
yeah,
maybe it's just being blunt or something. Like
yeah,
they like
exactly,
they're like, "Are you guys
exactly."
upset?" We're like,
Yeah,
"No,
right,
just
right, right.
literally just conveying info and like seeking
Yeah,
info back.
exactly.
Like
Yes,
I was
yes,
just busy, right? And you
right,
feel
right.
bad, but you're like, no, it wasn't meant that way at all.
Yeah, yeah, yeah.
That's one of. So what's on the horizon as we wrap up? Like, what's on the horizon for you? What are you doing? Some public speaking? You do a lot of conferences. What all is happening?
I will be at Becker's in November. I did a panel for them this spring, and they asked me back this November, so I'll be doing that. Um, Honestly, the time that I have, as you remember, it took us a while to even get this on the books. We've been trying to get this one scheduled for how many months now?
Well,
Just
rehabilitation got in the way and health
Yeah,
got in the
right.
way,
It
right?
literally got
So
in the way. It
literally
literally
got in
got
the
in the
way.
way. Yeah.
So
I do a few things a year, but that's for that reason too, because I still am very much connected to my family, and I'm very much
good.
connected to the hospital.
Yeah.
So there are only a couple of things that I will allow myself to do, outside of that. What I do love to do though is I love to support various things in the community that we as Rio, as we call it here in Dayton, whatever we can do. So that means supporting the American Heart Association. It's supporting MS. It's supporting stroke with our joint venture partner Premier. It's making sure that we have health literacy surrounding heart disease and stroke and those types of things from a prevention standpoint. And whatever we can do to help further that information to get that word out, the better. And I think that's vitally important. You do have a responsibility, in my opinion, that if you do have the platform to do so, do good with it. And even if it's when we did a trunk or treat out in the parking lot, it was about educating the community about what we do. So many times people don't even know what a rehab hospital does. They think that it is a nursing home. But when they realize that, this is what we do and who we do it for, and
Right.
really going out and talking with seniors. We've got a really great guy named Jerry on our team, and he'll go out and do stuff at the senior citizen centers and do body. He's an occupational therapist assistant, and so he does chair movement and things like that, and meets people where they are. And I just feel like the more that I can help support those types of things in the community, it has even farther reach than even I can, even if I go to speak with you or at Becker's or anything else like that. But right here where I am with these neighbors and friends and things like that, whatever we can do on that local level to promote health prevention, doing that, I think is just that is what drives me. I also ask the people in the hospital, our staff, what causes are important to you. And I try to figure out how we can support those things. We participate in the Heart Walk.
Yeah,
We
we do
do
that too. Yeah, that's
cancer
wonderful.
walks. Yeah,
Yeah.
yeah, and we just and there are ways that the staff can become engaged. So one of the things that we will be doing in the next couple of weeks, um, we do what's called pie a leader in the face. So
Really?
yes,
Gotta love
yes,
that.
yes. Do you gotta love it? I don't know.
Get- Gotta love that.
Yeah,
Being able to
so
hit the boss with a pie in the
yeah, yeah.
face, like
But
that is old school
yeah,
release of
yeah,
frustration.
yes. And so
Like,
there's a mason jar with every leader's face on it. You buy
oh
a
my
raffle ticket,
gosh.
you drop it in there, and the top three leaders, they're the ones who get pied in the face. And
Oh,
because your name is in the jar, we draw names, and then whoever the winner is, they get to be the one to put the pie in that leader's face. So
wow.
yeah, we do a lot. We have a ball with it. We also we used to do a dunk tank thing, and
Oh yeah.
you could dunk a liter. However, Dr. Brian Walsh, he's our medical director. I've also got a bad back. He has a bad back. He's like, I don't think we can do that anymore.
He's like, we're getting a little older. Can we not be dunked? A pie in the face I can recover
Yeah,
from,
that I can work around. That I
right?
can work around. But we just
Falling on
have
some,
fun.
yeah,
Sometimes you spend so much time at work, sometimes more than you even do with your own family during waking hours. And to create an environment where you're just having fun, when you're having fun at work, that bleeds into how you interact with patients and their families. And so we just always want to just have a good
yeah.
time, care for each other, care for our patients, and just enjoy it.
That's wonderful. Hey, thank you so much for your time today.
Oh, you're
That
very
is
welcome.
that was
I appreciate the offer. I appreciate it so much.
Yeah, this was absolutely wonderful. Check out Encompass Health. We'll have links in the show notes. Connect with our illustrious guest. Great discussion on leadership. Like you really hit all of the examples of like ways to execute on good culture and good leadership. It was really refreshing to hear.
Yeah,
So
well, thank you. You have to love what you do I think, to do it even halfway well.
yeah,
But
absolutely.
yeah, but I'm surrounded by so many wonderful people. They make it all look easy. They're the ones who really
Yep.
do the work. Yeah,
Yeah, as am I. But that's like they just prop me up here and throw me in front of a
literally.
camera.
Yeah,
Like literally
literally.
prop me up and throw me in front
Yeah,
of a camera. So thank God somebody's doing it. Otherwise,
I tell you the
who
truth.
knows?
Yes,
Right.
yes.
So well, thank you so much. And
Thank
we will speak again
Yes.
and we will talk soon. Thanks
All
everybody
right.
for listening.
Thank you
And
so much.
our next episode will be coming on shortly. Thanks.
Thank you.